What's up everyone? Vitamin K2, it's another super hyped molecule in the anti-aging community. There's claims that vitamin K2 will stop heart attacks, strengthen our bones and protect our kidneys. Now I must admit, when I first heard about vitamin K2 stopping heart attacks, I thought this was ludicrous. In the hospital, we inject babies with vitamin K to prevent life-threatening bleeds. So the idea that vitamin K2 would stop blood clots around the heart, it just seemed ridiculous. But after looking at the data, I became more and more interested. So in this video, we'll go through what vitamin K2 actually is, how it works, what the research shows, and what I personally do with that information. By watching this video, you'll give yourself the best chance to protect your heart, protect your bones, and you'll do it safely. And if you like this video, please do smash that thumbs up button. It really does help with the YouTube algorithm. Now let's get into it. Alright, so what actually is vitamin K2? So just a brief history lesson. Vitamin K, it comes from the German word coagulation, and that was because it was deemed to be only essential for its anti-bleeding trait. And this is how in the hospital we use vitamin K in our clinical practice. So due to well-established guidelines, vitamin K1, it's administered as a medication. For instance, newborns, they're given 1 milligram of vitamin K shortly after birth to prevent potentially lethal vitamin K deficiency bleeding. But that's not why you clicked onto this video. The health benefits of this micronutrient were shown to extend beyond bleeding, ensuring the correct function of several proteins. So vitamin K, it's implicated in age-related diseases such as cardiovascular disease, osteoarthritis, and osteoporosis. So it's for bold claims like that for why people are getting so excited about vitamin K2. It looks like we can protect our hearts and our bones. So how is this working? How is vitamin K2 helping in these goals? So vitamin K, it's crucial for the function of vitamin K-dependent proteins, known as GLA proteins. So it's these GLA proteins that seem to be at the core as to why we get so excited about vitamin K2. So these activated matrix GLA proteins, they're identified in atherosclerotic plaques and may prevent calcium precipitation and soft tissue calcification. So in English, all this means is that it looks like these GLA proteins, they make sure that the calcium's actually in the correct places. We want calcium in our bones, we want them to be strong, but we don't want the calcium in our arteries. We don't want the calcium blocking up our arteries, causing heart attacks and liver damage. So while vitamin K1 is retained and exerts its function in the liver, vitamin K2 is redistributed to the circulation and other tissues. So by making sure that we've got healthy levels of vitamin K2, we're switching on these GLA proteins. We're making sure that our blood vessels are healthy. And just to get the point across about vitamin K1 compared to vitamin K2, if we have a look at this picture, we can see that vitamin K1, it's all in the liver, whereas vitamin K2, it's all around the body, and that's the important part. So in a nutshell, that's how vitamin K2 works. It switches on those GLA proteins in our bodies. But there are a few different forms of vitamin K2. So which one is best? So vitamin K2, it can be divided into subtypes, namely short chain, so MK4, and long chain, such as MK7 and above. And out of all of these forms, it's MK7 that's absorbed most efficiently and exhibits the greatest bioavailability. And that's the key part. If we're taking vitamin K2, we need to make sure that our bodies can actually absorb it and use it. We want to make sure it's activating those GLA proteins. And just to drive that point home, the bioavailability of MK4, it does not reflect an increase in the blood level concentration. However, MK7, after you give it, it does have an increase in the blood level concentrations. Plus, those levels are increased for several days. So if MK7 is better than MK4, what about if we keep going? What about MK9? So MK9 has a very long half-life, as in it stays in our body for a long time, but unfortunately it's poorly absorbed. So it looks like MK7, it's best absorbed and it sticks around in our body for a long time. And finally, it appears that MK7 has all of the functions of MK4, but it just sticks around in our body for longer. So from here on out, since it appears that MK7 is the best form of vitamin K2, that's the one that we're going to be concentrating on. So what does the research show? If we take vitamin K2, what's that going to do to our bodies? So it looks to be a great antioxidant. It lowers concentrations of inflammatory markers, and it may also reduce reactive oxygen species generation. And overall, it looks like vitamin K2 may exhibit an antioxidant activity of 10 to 100 times higher than any other known radical scavengers. So that's a big tick in the right direction. Vitamin K2, it can be a powerful antioxidant. What else can it do? So it's been shown to be effective in the prevention and treatment of osteoporosis. So osteoporosis is just where our bones become weak over time. They break easily, not what we want. And in a study where they gave 375 micrograms of vitamin K2 for 12 months, it stopped the decrease in bone mineral density compared to the placebo group. So from this study, it looks like vitamin K2, it can stop the process of osteoporosis. And a longer study over 3 years also demonstrated the same thing, that it reduced the usual age-related decline in bone mineral density. And just to drive that point home, a systematic review where they pulled together all of the relevant data, it showed that vitamin K2 prevented fractures by around 60%. So that's a really high level of evidence that vitamin K2, it can help protect our bones. Now let's move on to our hearts. Vitamin K2 has been proven in numerous trials with healthy and diseased patients to have a long-term protective effect on the development of calcification. So this comes back to what we were talking about before, about activating those GLA proteins. We want to make sure that our calcium, it stays in our bones. We don't want it to go into our blood vessels where it can calcify, where it can block those blood vessels. So the GLA proteins, they inhibit the vascular and soft tissue calcification when activated. And to see if this theory works, a study with over 4,000 people were followed up for 7 years. And the people that had the highest intake of vitamin K2 had a reduction in their heart attack risk, all-cause death rate, and severe calcification. So that's a massive step in the right direction, but it's only one trial. What do other trials show? Well, it's the same thing with this trial with 16,000 people followed for over 8 years. Again, the higher intake of vitamin K2 was significantly associated with a reduction in heart attack risk. Now, all of those trials, it wasn't actually supplementing the vitamin K2. It was just having a look at the diet that would be high in vitamin K2. So what about trials that actually do supplement the vitamin K2? So in this trial, over 3 years, they supplemented 180 micrograms. And again, it was shown to reduce the arterial stiffness. So far, the conclusions drawn from clinical trials, they're still quite limited by the small number, and more robust clinical trials, including larger number of patients, need to be done. But the initial data that we've got, that vitamin K2 can help reduce our heart attack risk, it's very promising. And if we just sprinkle a few other potential benefits that vitamin K2 may have, if we start with diabetes, it was demonstrated that just 10 micrograms of vitamin K2 decreases the diabetic risk by around 7%. Studies done in the lab, it shows that vitamin K2 supplementation may prevent the growth and metastases of multiple cancer lines. And finally, regarding the kidneys, vitamin K2 supplementation, it's been shown to improve the kidney artery function and prevent further development of kidney artery calcification. So there are a lot of potential benefits of taking vitamin K2, and the initial trials, they look very promising. But what about the risks? If in medicine we're using vitamin K2 to reduce the chance of fatal bleeding, does that mean that if we overdose with vitamin K, that we're going to be creating clots everywhere in our body? Well, from the trials, an important conclusion has been drawn relative to the safe use of vitamin K2, since no adverse effect or document toxicity has been seen. And importantly, no high clotting state was observed. So from those studies, it looks like at reasonable doses, vitamin K2, it's a safe molecule to take. So what's the ideal dose of vitamin K2? Well, the typical recommended vitamin K intake varies from 50 to as high as 600 micrograms every day, and that's for vitamin K1. So it looks to be similar for vitamin K2. We still need a lot more data to figure out what the best dose is for vitamin K2. Personally, for me, until there's more data, I'm going to stick to 90 micrograms every day. So that's an increase from me. I used to only take 45 micrograms. But after going through all of this data, it seems very safe to take vitamin K2 at 90 micrograms every day. And I've chosen to take vitamin K2 because when I have a look at the benefits, the data looks to be very promising. Whereas if I compare the risks are very low. So the benefits are outweighing the risks. And that's why I've chosen to take vitamin K2. But I do want to stop and give a warning here about vitamin K2. If you're on warfarin, it's important that people are aware that vitamin K2 can interfere with the anticoagulation therapy, when used above 50 micrograms every day. So if you've been prescribed blood thinners from your doctor, it's important that you let them know that you might be considering vitamin K2 because it might be getting in the way of those blood thinning medications. And just like any other supplement that you might be considering taking or that you already are taking, please let your doctor know about what you're doing. It's vital to keep them informed. But if you don't want to take a supplement and you want to get your vitamin K2 from your diet, how can you do this? Well, unfortunately, vitamin K1 is the predominant form of vitamin K in the diet. So vitamin K1, it's found in green vegetables, whereas vitamin K2, it's synthesized by bacteria. So while you can get enough vitamin K1 from your diet, it's less clear if you can get enough vitamin K2 from the diet. And that's why some people, including myself, have chosen to use a supplement. And one final point that I do want to mention in this video is vitamin D3. So vitamin D3, it does appear to work in tandem with vitamin K2 to protect our bones and protect our hearts. So a lot of people, they do take vitamin K2 with vitamin D3, and that's exactly what I do. So please let me know down in the comment section below what you thought of this video and what you're going to do about vitamin K2. Are you going to start taking it, or are you going to wait until there's more data? And once again, a huge thank you to all of the Patreons supporting the channel. You guys make this content possible, and I can't thank you enough. And one final plug, if you liked this video, please do smash that thumbs up button. It really does help with the YouTube algorithm. And until next time, thanks very much.